All right. Welcome, everyone. Thank you for joining us today for our webinar on a shifting perspective, aligning your NGO's travel risk management strategy to our newish normal. We have today representatives from two of our industry partners, On Call International and Allegiant Global Partners, as well as NGO All Hand and Hearts. So today we have Eric White from On Call International, Gary Pitts from All Hands and Hearts, and Anne Bernger from Allegiant Global Partners. I'm very excited to welcome them here today. And to get started, I would just like to go over a few housekeeping tips. So we do have captions available. You can turn those on by clicking live transcript or live subtitles at the bottom of your screen. If you have not updated your Zoom in a while, you may not see it, but we will have the captions in the recording. We are recording the webinar, so we will share that with everyone following the webinar later today or early tomorrow. So you can keep an eye out for that email in your inbox from Humentum. We will also be taking questions at the end. So if you have questions while we're going through the content, please go ahead and put those in the chat and we will keep track of those so that when we get to the end, we can make sure that all of your questions are answered and we get you the information you need. So with that, I'm going to also thank all of our industry partners. So as I said, we have two of them on the call today, and we're very grateful for their support and the expertise that they offer to all of our members. I'll drop a link into the chat in a moment that will provide more information about what each of our industry partners does. I'd also like to remind you that as members, you have access to a variety of benefits, and these will be linked in the recording as well. So you can check out all of the discounts, networking, and other opportunities you have available. And then finally, this webinar is just one in a series of other webinars we have every Wednesday. So we have these upcoming topics, learning and development, cybersecurity, and ESG investing. So make sure you check those out and register if you are interested. So now I will hand it over to our presenters to share a little bit more about themselves.
Thank you very much. And I'll start by, and if we move straight on to the next slide, you've introduced us to that much already, and we'll introduce ourselves at the beginning as well. I'm going to start by just running us through the agenda, and I'll carry on through this first element of setting the stage. I'll then hand over to Eric. Eric will talk to us about risk assessment framework, how that all works. I'm then going to come back and tell you how we at All Hands and Hearts applied some of those principles in our real world scenario. Then we'll hand over to Anne, who will help us understand the assistance that Allegiant gave us and how we were able to work with these partners to fulfill our duty of care. And then, as we mentioned at the end, we'll have plenty of time for questions and answers when we get there. If we can move to the next slide, please. Thank you. So what are we here to discuss? Really to set the scene, I think travel is an essential part to many organizations like us. It's fundamental to how we deliver. I think it traditionally has been. And the pandemic introduced more challenges in how we can travel responsibly and safely. I think that in some ways that's accelerated other factors that we see in the world as well, such as considering our carbon footprints, localization of aid and things like that. But nonetheless, it's been a big driver in again, changing how we think about duty of care in regards to travel. Next slide, please. So, as I mentioned, the pandemic has required us to shift perspectives to find new ways of thinking about travel and raised a whole new load of questions about travel risk management and how that impacts our duty of care. Those kinds of questions include, how do we effectively assess the risk when it comes to non-negotiable travel? How has the pandemic affected our duty of care? and what does an effective risk management strategy really look like in this newish normal situation that we find ourselves in. So I'm going to hand over to Eric now. He's going to lend us his expertise to understand how we can really assess the risk in this complex and evolving situation. Eric.
Thank you, Gary. I appreciate it. And just first off, a little introduction to myself. My name is Eric White. I'm a global security specialist with On Call International. We're a travel assistance company based out of Salem, New Hampshire in the US that provides security, medical, and travel risk management solutions to our clients. We've done everything from security evacuations out of high-risk environments to medical evacuations and air ambulances. As you can guess, recently we've been very active with providing support to our clients throughout the COVID-19 pandemic. So that's a little bit about me to kick things off here with how do we think about risk, or how do we define risk too. So this can really vary between different organizations. Risk designation isn't just going to be location based necessarily, but it's also going to be based on the individuals at that location, their experience and the organization's experience operating out of that location, and what support systems are in place to mitigate that risk too. And that takes us to tolerance versus appetite. So how much risk is your organization willing to take on when it's carrying out its operations? And at what point is the risk going to be too high where you're unable or no longer want to be conducting your operations? And with that, we can look at onset velocity too, especially I think during the COVID-19 pandemic. We've seen that situations can change very quickly, and how quickly are we able to get the information and react to these kind of situations? And are you as an organization prepared to rethink, readjust, and react to changing circumstances, particularly during this pandemic? Next slide. So talking about the pandemic and how we're assessing risk during these times, we have to take into consideration a certain degree of uncertainty. As I mentioned, the COVID-19 situation in several countries can fluctuate. Countries that have minimal cases one day can see cases climb drastically over a short period of time. And the situation within that country can change based off of new restrictions that are imposed, or more entry requirements that are going to make it more restrictive to even get into that country. Also, one thing that you want to consider is vaccine efficacy and the ability of current vaccines to prevent future COVID-19 variants. While most studies show that current vaccines are fairly effective against variants to varying degrees, there's also a lot of rumors and myths out there about the effectiveness of vaccines, the safety of vaccines too. So we want to make those considerations, because even if there is just a rumor or some kind of a myth about a vaccine, governments can still act on those when they're changing their policy. And finally, we want to look at how you're handling COVID-19 positive staff. What measures do you have in place, or proactively do you have measures in place to isolate that staff member, to get them medical attention if needed? What are you going to be doing if they're operating out of a country where there's a poor medical infrastructure, and maybe they're not able to just go to a hospital within that country or get treatment within that country if they're a foreign national maybe? Do you have a plan in place for handling those kinds of situations? Also looking at too, how's your response to COVID-19 positive staff going to vary between local nationals versus expats within that country? Do you have different methods of response or different response plans in place in those two circumstances? And as I mentioned too, Are you aware of the COVID-19 regulations within a country that you're operating out of? Some countries may require you to report any COVID positive staff that you have, or anybody that is COVID positive will have to report that. Different countries have different regulations too on whether or not that person has to isolate, test, if they have to be quarantined in a facility if they test positive. So you want to be very aware of that, considering any COVID positive staff. Next slide. So we're already assessing a country's risk profile based off security, natural disasters, or political stability. We've been doing that since before the COVID-19 pandemic. But we also now, as I mentioned, need to take into consideration the COVID-19 specific situation in a country when assessing risk there. So I think one of the things that I brought up here are you considering a country's entry requirements when considering your operations there? These can fluctuate constantly. I think we're seeing with the US now too, as of November 8th, we're going to be changing our rules as far as entry. Other countries are doing this constantly too, sometimes on short notice. Some things to consider also is countries that may require proof of vaccination. How is that proof of vaccination going to be delivered? What's it have to actually look like? Is it going to be your CDC card for a country, or is there a specific app that's going to be downloaded that you're going to have to then upload proof of vaccination through that? It's all going to vary by location. Also consider too an individual's nationality if they're traveling to a country. So certain countries are going to restrict entry from citizens from certain countries. Also, it could affect just the country that they're traveling from, or it could also, entry could be restricted based on any recent travel history that they've had. If they've been recently to a country where entry is restricted from, they may not be allowed in. So all of these factors are incorporated into a country's entry requirements. You also want to look at COVID-19 testing, as well as some countries too that do have insurance proof of coverage in case you do become COVID positive. So just remain aware of those when you're considering the country risk profile as far as COVID is concerned. Also too, we're looking at the domestic restrictions within a country. So at on-call, we're always advising clients, are you going to need a mask when you're out in public in that country? What's the status of transportation within that country also? A lot of countries have suspended public transportations in certain locations due to COVID. So are you aware of that? And have you come up with contingency plans for getting around the country if your mode of transportation is restricted, or if the country just has a history of restricting that during the pandemic? That kind of indicates that that could happen again. Also, too, are curfews in place? Make considerations for that as well as any movement. One thing that we also want to understand too is the ability of a specific country to be able to cope with the COVID-19 pandemic. Are hospitals overwhelmed? Is testing readily available? What about ventilators or medical supplies? Are they limited? These are all things that we really want to consider. Next slide. So the next thing that we look at is really getting into the risk profile of the individuals that are going to be traveling or operating out of another environment or another country. So like I mentioned earlier, one of the big things that we're considering is local nationals versus expats. A local national may have more personal resources in place, but you may see too that people from varying nationalities may just have access to resources outside of the country and an ability to get out of the country and access different resources. So these are things that we want to take into consideration. One of the biggest things that we take into consideration, not just for the COVID-19 pandemic, but also just in general, is gender and identity details of the individual. Depending on the country, different genders and gender identities may have access to varying resources as far as LGBT individuals too. In some locations, they can have a lot of difficulty asking specific resources or accessing specific resources just based on discrimination. that's just, something you always want to take into consideration. Also, too, we're going to be looking at an individual's experience while they're abroad. Have they been to that destination before? How familiar are they with it? Do they have any personal contacts there? These are all things that we want to be looking into when assessing risk. Next slide. So finally here, what I'm going to go over is just how we're going to mitigate this risk. One thing that I'm sure most people have done within the US, and we're also seeing a lot abroad, obviously, is COVID-19 vaccines, as well as testing. Just knowing the location of testing centers within a country, as well as the testing requirements. Also considering to intelligence and communications. What intelligence are you monitoring while you have operations in a specific location? Some good resources that we use, I think one of the greatest is just looking at the official government websites for a specific location, as well as foreign embassies within that location too. Just looking at their websites, seeing what information that they're putting out there. At On Call International too, we'll also have our clients come to us asking us for information, and we'll review it like this. And sometimes that requires contacting an embassy or the health ministry in a specific country. And then finally, too, as far as mitigation, what is your plan to pull the trigger, as we say, or to shut down a program if it becomes too risky? Do you have established tripwires in place that indicate that the level of risk is too high and operations need to be suspended or curtailed in some way? And then also looking at the reverse of that too, the reverse tripwires or program continuation. So what circumstances have been met that now allow you to resume operations in a particular destination? Have their COVID restrictions been reduced or cases drops? As I've mentioned, risk can be very fluid, and we need to be prepared for this kind of changing environment and have a plan in place for what we're doing as far as not just stopping, but resuming operations. And next slide. So with that, we've kind of looked at how On-Call assesses and advises on mitigating risk. Now I'm going to hand it over to back over to Gary from All Hands, All Hearts, who works with On-Call to discuss how they're putting their risk mitigation measures into more practice. Gary?
Thank you, Eric. Yes, thank you. That was really good. I was going through the checklist myself as you were talking. And I'm going to hopefully now show how we put some of those things into context. Again, I'll start by introducing myself once more. And why I'm talking to you, right? So I've been in the industry for just over 8 years now. I spent 5 of those years as our Director of International Response. So I was one of the first people deployed to go in and assess disasters, understand the needs and design programs that would meet those needs. So I have a good understanding of the situation from the ground. And I did that in a lot of different contexts, around 20 different times, a couple of different organizations. After 5 years of that, it got a bit tiring. Being on call, kind of to jump on a plane with 24 hours notice takes its toll. So I was lucky enough to move across and become the Chief of Safety for All Hands and Hearts, where I was in that position for 18 months up to the pandemic. Started off designing a holistic safety management system, introducing some of the concepts that allowed us to adapt to the pandemic easier. And then a fantastic position to be in during the start of the pandemic, no pressure there. And through the pandemic, I was lucky enough to become the Chief Operating Officer, and I've now been there for about 18 months. I retain accountability for safety in that role. So again, I've been very much involved in how we think about the pandemic within our organization, within all the factors that Eric just mentioned. Sorry, let me catch up. So I think the point of this slide is just to say, we're all mission-driven individuals working for mission-driven organizations. And sometimes our duty of care and the way that we think about that is focused on the community, especially at the ground level, and often we'll forget ourselves in that as well, again, by being driven to the mission. And it's really important, especially with the pandemic, obviously. I think that caused us to reframe how we think about that, and required us to think about ourselves equally. Again, I think there's other factors driving that as well, but other factors drove us to consider that. Next slide, please. So as we at All Hands on Hearts looked at the situation with the pandemic first started, in some ways we're in a lucky situation where we're not delivering life-saving services. So we're able to actually pause for 6 months, which was very advantageous. It gave us a time to learn and understand. I know for many of you, you're out there and had to keep delivering, and I'm sure that was a lot more complex. I was lucky here. Through those 6 months, we spent a lot of time listening to experts, building networks, understanding as best we could, and effectively assessing the risk and putting in place plans. From all of that work, we developed, it says worst case scenarios, but I think really likely worst case scenarios what we developed. And in no particular order, I'd like to kind of go through kind of 5 of those and how we address them as well. Whilst I say no order, I think this one is the most important. And it is, the first one was preventing us from spreading COVID-19 into a community, and especially vulnerable members of that community. That's obviously core to what we do. We very much believe in do no harm, and that was a clear indication of a way that we could do that. We took steps to reduce the risk of that happening through good arrival protocols, by whether required by the country or not, making sure that we had a quarantine period, making sure that we undertook multiple levels of testing to the best efficacy that was available to us in that location, to again make sure that we weren't bringing in anything. Especially important when we think about variants. You certainly don't want to be bringing in anything new to an area. We also, and again, with a variant thing, but one of the key things we also did was really reduce the amount of physical interaction we have between our teams and communities, making sure that that was really kept to truly essential, and where it was essential, make sure that PPE was correctly used, physical distancing, the common things that we use. And through that and a series of other communication methods, we have prevented ourselves from spreading COVID into the community. The next key likely worst case scenario we thought about was a member of our team developing severe illness due to COVID-19. Luckily, there was information available about that quite soon, especially within that 6 months that we could act on. And we took appropriate action. So first, we had to accept that our team could get COVID, and I think that was unavoidable. So it was really about reducing the severity when/if that happened. To do that, we made sure that the people we were deploying weren't suffering from any potential underlying medical conditions that would make them more likely. And we also took the step of saying anyone over 60 or 65, according to the advice at the time, again, didn't deploy to the field. Somewhat tough decisions, but again, it was the only way that we could see to really control that severity. Obviously, as we sit today, the vaccine is a great tool there. Again, for all of the questions about it and the unknowns, it is quite clear that it does well at preventing severe illness. So again, that's allowed us to re-look at that risk assessment and act accordingly. Another important factor that we considered was the perception of the threat that we offered to the community. As you'll likely be aware, we rely on acceptance a huge amount as a security strategy, and we didn't want to potentially open up other risks by harming the acceptance of the community of us. So as part of our return, or as part of our entry to a new community, we'd make sure that we built strong communication with the leaders and the relevant actors in that community, and establish ways to provide regular updates, to report when there were challenges, and also to make sure that we work with them to understand what it meant and how they could protect themselves from us, as well as what we were doing to protect them from us, if that makes sense. Again, that so far has proven to be very good, and we put a lot of focus in maintaining that acceptance from the community. Another factor we considered was the interruption that COVID could add to the program. And a lot of this risk we had to accept. Early on, we kind of sat down and just immediately said, you know what, we're talking about 20% more on top of budget. We refined that over time, and it differed according to location, but that was a good decision to make, and something we could kind of present to the board to set expectations. So we built in additional contingency. We anticipated that things would be delayed, but we also took actions to reduce the severity of that once more. We did that by compartmentalizing our program. Early on, we identified that this is very contagious. If all of our people are in a single housing, a single case could take out the entire team to stop delivery. So we compartmentalized our teams, we called them bubbles, so that, again, there was no kind of immediate physical contact between those bubbles. That allowed us to say, well, even if we do get one single case, the other bubbles, and generally we try to have at least 3, could keep on delivering, and we designed the bubbles to be almost independent in some ways as well. And that largely was effective. We certainly had cases. Through our testing, we were able to identify them quickly. Through our isolation protocols, we were able to act swiftly. We would quarantine the rest of their bubble and put them through a more intensive testing process. Again, releasing according to the best advice available at the time, which again generally was 14 days, which I'm sure we're all aware of. But that also had other impacts as well. You know, from when we sat down, we knew that mental health was going to be impacted through the reduction in interaction with people, and also not least at this point, you know, people coming back from 6 months where maybe they've been locked down in their home countries, maybe they've been through personal situations, and honestly, I think that's something that we learned quickly. Could have done more there, and something we quickly invested more in, bringing in-house some kind of mental health professionals to help us better manage people's well-being in general. But yeah, certainly I'd say that was one area where we learned a lesson there. Last but not least, again, relating back to something that Eric was mentioning, was we had to consider what are the indirect impacts in some ways of COVID as well. So we can't say that we can avoid accidents. We can't say that, yeah, we can guarantee a road traffic accident won't happen. So we had to think about, well, what about hospitals? What about again, the other impacts on infrastructure that we might rely on in normal times, and how is that being impacted by COVID? And if we go to the next slide, please. So this all factored into our travel decision-making process. We needed to make those decisions. Again, we had 6 months to plan how we were going to make those decisions, and I think we used it well. We built a set of indicators for each of the places that we were looking to return to. And those indicators were monitored on a very regular basis. We actually set up specific in-house teams to continually monitor the certain parameters. And the parameters were customized to the location. As an organization, we work both in the US and internationally. There were some key differences between that, not least in the level of information we're looking at, or the source of information. So in the US, we're looking at the state level. We're looking at the county level, understanding what restrictions there could prevent us from being able to work, and again, prevent us from able to build the acceptance with the communities that we're working with. Internationally, we were looking more, again, Eric mentioned some before, in terms of what are the government doing, what have they done in the past, how likely is it they might close the borders again if they've just opened them. We work with epidemiologists to understand from the best data available, what was the rate, and think about what could potentially happen. Again, indicators are a good kind of foresight technique to hopefully help us predict what's going to happen. A great indicator we looked at was airlines. when airlines were starting to reinstate their routes into countries. That gave us a level of confidence that they also felt that that was going to be a more stable location, though there was a large range of them. Once we had made those go, no-go decisions, situational awareness became really important. Again, continuing to work with those indicators, we moved them to the ground. We had a team on the ground that would then monitor those at the local level, as would make sense. And we also established a series of what we called red lines, what Eric referred to as tripwires. They would include things such as the capacity at the local hospitals. Again, thinking about, well, if someone does get hit by a car, we need to be able to enact our medical emergency contingency plan. If we're not aware of the situation changing around us, that might prevent us from doing so. And then we'd have a decision tree around, is that a pause of the program? Is that an evacuation, and so on? I hope, as a sign of the quality of our indicators, we never had to actually pull a program back out once we deployed. But again, in some cases, we'd choose to address the problem in a different way. So if there was a piece of work that was outstanding, maybe we would use local contractors to complete something that was halfway through opposed to sending our team back in. Again, making sure that we made the right compromises in terms of meeting our commitments, but also managing safety and making the right decisions in terms of duty of care. With all of that, I'm going to hand over to the trusted advisor that we used to help us work through all that, and that is Anne at Allegiant. And they were just one of the experts that we relied on to help us fulfill our duty of care. Anne, to you.
Fabulous. Thank you so much, Gary. Well, it's great to see so many familiar names, like I would say faces, but it's all names. And again, just as a brief introduction, as both Gary and Eric did, my name is Anne Bernger. I am the Director of Account Management and Client Satisfaction at Allegiant. And I have the amazing privilege of working with partners like Eric and Gary. And Gary could not have more succinctly set the stage for me, set the table for me in terms of the kinds of things that I really just want to leave you all with from an insurance and insistence perspective. The place to start in all of this is to really be as proactive as you can be. And the thing that I think we in the industry that I'm in have come to realize is that, yes, there are many unknowns, but you could plan for the worst case scenario, right? In all cases, you can always plan for the what ifs. And I think the pandemic has given us an incredible, sad as it is, but an incredible opportunity to really be thinking about what are the possibilities, and how do we best ensure that our duty of care for the teams that are out living and breathing and walking our mission have the kind of supports that they need. So very practically, what I would say is when you are working with your teams to understand the policies that will best meet the needs, start with what are you looking to truly secure? What are you looking to truly cover? What are the elements that you feel are a must as you bring forth the strategy of your organizations? And if you start with that as the backdrop, you'll be thinking about that regional appropriateness. You'll be thinking about the ways to integrate that strategy. And while I put up here, there's no magic pill and one size does not always fit all. It will, if you have that perspective on what you're looking to do, as you work through the options with your wherever those carriers are, whether they're medical, whether they're assistance, whether they're security and natural disaster, you'll be able to review the options through that lens, right? You'll be able to understand what are the things we're looking for and do these offerings provide us with that? And that also becomes important when you get even more into the weeds, where you're actually looking at the structures of those policies and those underpinnings, so you can really be sure those things are there for you. The other thing I would say is, be sure when you're working, with whoever that is, whether it's an Allegiant, an on-call, what have you, that you really ask about things that maybe aren't in, the initial conversations. Check about things in terms of, are we able to add a little bit more here or a little bit more there? Can we ensure that while we might be able to do an evacuation for a TCN or a US expat, what about in the case of a local national, what that might look like? So I think it's important to feel like there's no question that shouldn't be asked. That's what these programs are meant to do. They really are meant to provide you with those kinds of pieces. And then, I would say, as you think about these things, recognize that things will change. There will be things that come up, and even though you can do as many what ifs as possible, there's always going to be, probably, I probably overuse the term always, but there will often be those cases where you just couldn't have imagined it. So don't be at all timid about coming back to, an Allegiant and saying, hey, what do you think about this? This happened for us. What are our options? We all, and I think I can speak for Gary and Eric specifically, we want to be sure that we are providing you all with the coverages and the solutions that best meet whatever kinds of challenges your teams are facing. Ultimately, we want you to feel unfettered to do your mission. And we want you to feel like you've got the right insurances and assistance programs in place to do it. So again, one size does not fit all. There is no magic pill. Things will change, and our industry is doing its best to stay fluid. And certainly be able to adjust to those things. So, from an insurance and assistant perspective, hopefully that gives you a little sense of, how we like to go at these things. These programs are out there, these abilities are out there, these conversations are wonderful to have. And hopefully, you get a sense that these opportunities exist, and we are out there to help you, and we want to be answering those questions and working with you as your partner to gain those solutions. So I will stop there. And I think, am I back to Gary or am I back to Eric? I'm sorry, guys. I'm not doing a very...
It's back to me, I think.
Okay,
I
thought it was you. I thought it was you, Gary.
Exciting. Thank you, Anne. And if you skip on to the next slide, please, and we're just going to wrap it up and move on to questions. So thank you. Hopefully that's been informative. Again, Eric's given us a view of how the many factors we need to consider, the framework that we can consider them in. I tried to bring that to life a little bit. I have many more examples if you want to ask questions about those. And then obviously Anne's helped us understand the assistance that we can get, and the different ways and we can leverage each other to get through what's been very complex times. With that though, I'd like to really open the questions, and I'm going to go on mute until one comes to me. But yeah, from myself, Eric and Anne, thank you very much for your attention so far. Questions, please.
Thank you, everyone. This is really helpful and informative. So if you have any questions, please go ahead and put them in the chat, or if it's a more complex question that you would like to explain, you can go ahead and unmute. If you would like to raise your hand first, just so that we don't have everyone unmuting at once, that would be helpful. You can raise your hand in the chat and participant side of the Zoom window. Anyone? Question? And what would you say is the most popular benefit now with all of the changes that have occurred with COVID-19?
The most popular benefit, boy, that's a good one. You know, I think the way that Allegiant thinks about this and this word's been used a couple of times, both by Gary and Eric, is from a holistic perspective. So I can't say to you that all of a sudden we've had this rise in medical evac, or we've had a rise in natural disaster coverage. I think what we consistently see are our partners, our clients wanting to ensure that there is a connection between the coverages. So in other words, the medical coverage will connect with the evac. So either looking for programs that have that all in, or looking for the medical programs that have a portion of that that can then be partnered with an on-call, for example, to ensure that there's that holistic coverage. So I'm not sure it's been kind of a new version of something. I think it's been, sort of an increase in focus on, let's make sure that we have connectivity between the coverages to ensure that full care of duty in the case of an incident that would require escalation and mitigation.
Great, thank you. Gary, could you share a little bit more about how you communicated your process for risk assessment and all of these things with your staff, and if you received any feedback from them about how safe they felt or comfortable they felt with the steps being taken?
For sure, yeah, and it was complex, and it took a lot of steps. I wouldn't say that we got it right on version 1, but I think, again, just trying to be as open as we could be, listen to that feedback and address it in a timely way. It's kind of a standard feedback loop, I guess, was key to it. And again, making sure that that first off, the team understood the situation as best they could before they deployed, and always gave them the option of taking appropriate actions, so they did feel safe once they were there as well. So again, it was very much a iterative process, let's say. We really did share absolutely everything. Shared the details, took the time to go through the actual risk assessments, but also present it in a way that was digestible as well. Listen to questions, and in some ways you kind of know that pre-deployment, everyone's excited. You're talking and you're like, I'm not sure you're really hearing me, and then you can obviously react to that a bit. Doing it remotely it adds another dimension of that as well, right? Which was what we're all forced to do. But that you want to schedule also some strong feedback sessions within the first days and weeks that they're there as well, and again, make sure there's lots of opportunity to address that, and also make sure that you're addressing not just the facts, right? It's very easy for me to just be about risk and be very analytical about it. I also had to drag in people that were better at the human side of it to me as well, and understand the feelings and the impact from that side of that point of view, not just what's the 1 to 5 rating of likelihood that this might happen, type approach. So that's hopefully answers the question.
Yeah, thank you. So we have a question from Lydia. Can you share how you budgeted for COVID-related issues, for example, additional hotel rooms or separate accessible transportation and vaccinations, and worked with funders to either make budget adjustments or obtain additional funds? And do you include reasonable accommodation for disability-related inclusion, for example, interpreters or accessible hotel rooms? I think this is more for Gary as a organization, but for Eric and Anne, do you have recommendations for your clients on how they can have these conversations with funders?
So I'll start there, and I alluded to it a bit in my presentation. We started off with a load of assumptions, and turned those assumptions into a very high level percentage. And that was important. We did that very early so that we could go to the board, to donors, to look for specific donors, to address some of those things. Again, we didn't know exactly what those costs were going to be, but we had a good anticipation of what those new costs would be. Again, through as we designed the controls, understood the new accommodation models and things. And some of that came from internal kind of emergency funds that we had for a rainy day, and this was definitely a rainy day. And then we also worked specifically with particular donors that were interested in helping us get back and complete work and fulfill commitments. Again, really that was working closely with the donors to understand what aligned with what their objectives were, and there was no shortage of costs that we're encountering, and we could really tailor and piece together various funds to really get to the targets that we had. Targets, I'm not sure the right word, you know what I mean. In terms of did we include reasonable accommodation for disability and so on, we were very specific with it. So we started at that very high level, but then, as with indicative of the way we usually work, we're sending a small team to assess, to work out, okay, well, the interpreters we do need, who are they, what are their needs, and of course we met. I don't think that I remember we necessarily have any special requirements for ability, but if that had been there, then that's how we would have built it in, again, by looking at it in a very specific way. And again, over time or through those initial assessments, we took our high level 20%, and in some cases it became 10, in some cases it became 30. But generally we worked out well, and it was around the mark that we'd estimated, and yeah, that's how we made it through.
Great, thank you. Eric?
Yeah, I think, just from our perspective at OnCall, as far as advising our clients, like Gary mentioned, having that emergency fund and the kind of proactive measures already in place in case something like this does happen, so that you're not, coming up with everything necessarily on the fly. Like you have somewhere where you can get this from, or you have a plan in place proactively so that you can handle the budgeting for something like this. I know it's kind of unprecedented too with the pandemic, but just in general, having that for in case something happens, having that proactive plan in place.
Great, thank you. Anne, go ahead.
Yeah, and just to sort of piggyback off of those things, one of the things we found is that there were cases that plans already in place had some support for these kinds of things, for the accommodations, for whether it be hotel or travel, or inclusive kinds of things. So the other thing I would say is never be afraid to come to an Allegiant and say, hey, can you kind of take a look and just go through our plan and help us understand, do these programs exist? Do these parameters of coverage exist? And again, that's an example of where we can be working with an on-call with an Eric and saying, hey, listen, we've got some folks really struggling with this. What are our options? And again, the proactivity is always utmost what we hope for. But I don't, if there's a message I can give you, don't feel paralyzed in the moment. Reach out to us, talk with us. It's really what Gary did. Hey, this is what we're trying to do, and this is what we're thinking about, and here's our strategy. Put your thinking caps on from a different lens, from a different filter, and help us understand what our options are. So, even in the moment, if you're not sure, reach out, because 8 times out of 10, there's probably something that we can help with. And the other point, while I have the floor, that I wanted to make, which reverts back to the first question, and Gary alluded to this as well, we have seen an increase in the need for very, sort of deliberate mental health kinds of support mechanisms. And again, that was a case where many of the plans, the insurance plans that our clients had had those pieces in them. But again, because you're not always thinking about them, and you may not be using them except for those people that really need them, you kind of lose track that they're there and they're available. So I would say that is one that has definitely come to the forefront, and we have been working with other carriers to be able to provide very focused kinds of support as needed. Some of it pandemic related, some of it natural disaster related, some of it, civically related. So that's another important element of, what is the plan that you have in place on your medical covering you for? And is it possible that you want to be thinking about some more strategic kinds of support that would be in place in the needs, should the needs arise? So I just wanted to circle back on that one as well.
Great, thank you. And I saw, Gary, you had unmuted just briefly.
Yeah, just to add a bit more to my answer as I walked away, I felt I wanted to add that the foresight was really important to controlling the budgets as well. We understood as best we could the variables before we went in. Again, we had the luxury in order to be able to do that, and that really helped us control that issue as well. If we had less foresight, less ability to predict the variables that we'd encounter, I'm sure the budgeting would have been much harder. So again, having that upfront information and making decisions off of indicators and so on helps you on the other end of it when you're counting the cost.
Great, thank you. Eric, could you talk a little bit more about the difference between risk tolerance and risk appetite, and when a risk assessment should be done? Is it any travel, specific programs, specific efforts, that kind of thing?
Yeah, absolutely. So I think when we're talking about risk tolerance versus risk appetite, we're looking at, how important, how much do we want to or need to establish this particular program or have this, individual travel to this location. How much do we really, really want to do that, and what level of risk are we willing to assume in order to do that? And then as far as risk assessments too, what I would say is, it's one of those things, anytime that you're setting up any kind of operations where maybe you're unfamiliar with that location, or there are some new variables that have been thrown in that significantly changes the circumstances in that location, that could indicate that there is a higher level of risk. Just, the big point of a risk assessment is understanding what could potentially impact my operations. And if that's changing, you want to know about that, and you want to know about the mitigation measures that are in place to either eliminate or decrease that specific risk. So I'd say, at On-Call, we do it not just necessarily for those high risk locations during COVID. We're not just looking at like in Afghanistan, for instance. We'll do it for any level of country. So throughout Europe too, during the COVID-19 pandemic, with a specific emphasis on the COVID situation and restrictions, and understanding how those restrictions could affect operations.
Great, thank you. I think one question that all of our members are kind of struggling with right now is not only what have you seen, and I think you shared a lot of this in the past 18 months and how you've adjusted, but what do you see as how people are adjusting their risk levels and their processes moving forward as, as we say, it's becoming the newish normal. So as things become normalized, are we seeing adjustments in travel policies or things where a heightened level of risk is becoming actually our normal accepted level of risk? Or are you seeing something totally different? I think everyone, that's kind of a question for all of you.
Yeah, I can start off with that one. So I think what we had been seeing prior to the pandemic was much more of a focus, I would say, on looking at things like crime, terrorism, political stability. I think in particular, 2019, as far as political stability was concerned, was a huge focus. And I think what you've seen is much more of an emphasis now on looking into the health infrastructure within a particular country. You know, what is their ability to cope with large scale health situations such as the pandemic. Also looking at transportation infrastructure with a lot more of a focus on that than there used to previously be. You know, is this something that's likely to be shut down? Looking at that particular government too, is that, you know, through past experiences and measures that they've implemented previously, how likely are they, if something does come up again, to implement just as restrictive measures? So I think that that's kind of been some of the shift in focus that we've seen. And then as far too as kind of the mitigation measures, like I've mentioned in my portion of the presentation, a lot of organizations maybe didn't have to previously suspend or cancel a particular program that they had. So the particular tripwires that they had in place for that maybe weren't quite as robust as they could have been, just because they haven't really had to implement those on such a large scale before. So there's been a lot more thought and a lot more focus that goes into that. You know, at what point are we going to have to take action? At what point are we going to have to shut down our operations? At what point are we going to have to pull our expats out of this country? So that's definitely been the shift in focus, I think, that we've seen, which is a good thing too, because not only can you apply those things like the tripwires to situations like a pandemic, but it's also good to just know in the future, you know, that that is a focus, something that we need to be paying attention to in the event of other kind of major situations that could affect our operations.
Great, thank you.
And to jump on there as well again, I would say that it more added new factors and added new challenges and required additional resources to make sure that we continue to look at the things we'd always looked at and dealt with the new factors that were brought on. I think there were plus sides from that, and it did require us to formalize things before that maybe had been left to the teams in the field to build their own models for. So I think as we come out the other side, we're certainly stronger because we have a more formalized way of thinking about situational awareness of red lines, of tripwires. I think also, as I mentioned briefly, the pandemic's accelerated things that were already happening, right? That we were already looking at a lot of these things that we had to innovate due to the pandemic, but they were already on the agenda. And it just kind of forced our hands in some ways. And again, I think we come out the other side as a stronger organization because we've been forced to solve those problems in maybe a shorter time frame, but yeah, helped us get the resources to do so as well.
Great, thank you. So we are getting very close to the top of the hour. So I know our speakers have a hard stop. So I want to thank them for their time and thank you to the audience all for joining. I'm going to drop two links into the chat. One is our link to our association health plan with Allegiant Global Partners. I think it's a really important benefit that a lot of our members don't know about and has been beneficial for those taking advantage of it in the past, well, whenever they've taken advantage of it, but particularly as we've been dealing with COVID-19, and then as well our upcoming Wednesday webinars, just so that you have those if you'd like to register for them. So Anne, Eric, and Gary, thank you so much for sharing your time with us today. I think this is really helpful. And as I said, everyone will receive the recording in the next day or so with the slides and all of the additional information.
All right. Thanks, everybody.
Thanks so much, everybody. Take care.
You too. Have a good rest of your day.